Honorable Minister, Chairman of this occasion, and eminent personalities on the high table. I recognize everyone here. Without wasting much of our time, I'll go straight to the address. It is a true pleasure to see a wonderful opportunity for us to make history in our country, Nigeria. This Geneith Health Competition is primarily to eradicate malaria in Nigeria, and of course help the institution mandated to eradicate malaria. It is a well thought out program to catch them young, focusing on secondary schools and indeed tertiary institutions, for us and for them to be ambassadors of war against malaria. This historical project is what is well thought out for these people to own it, to know that malaria is a collective effort for us to fight. And today, this competition, we want to specially thank the MD of Geneith Pharmaceuticals for accepting to sponsor this competition, giving away over $1 billion for this great event. The people at the secondary school and of course tertiary institution will be winning over 400 million, and indeed over 600 million in gifts for this competition. It's one of its kind in Africa, towards making them to own fighting malaria through quiz on malaria and health. Please, we want to urge eminent Nigerians to follow suit on what Geneith is doing through Quota that is powering this project. We're very happy to welcome you all. Thank you and God bless you. It is very important that what we're doing today is a holistic thing. We have the student bodies here, the president of National Association of Nigerian University Students, president of National Association of Nigerian Polytechnic Students, president of National Association of Nigerian Colleges of Education Students. They are all here. May I have you rise so that they would all... The reason of bringing them here is because what we're doing is student-focused, centered projects. If we must achieve eradicating malaria in this country, these are the people that will drive it. And that is why they are actually the drivers. Thank you very much for your time.
Good afternoon, ladies and gentlemen. The gentlemen of the press, our distinguished guests, esteemed advocates of public health, the members of the high table, starting with our dear chairman, ladies and gentlemen, please permit me to stand on the existing protocol. It is for me an honor indeed and a rare privilege to address you today at this critical point in our ongoing campaign against malaria. As the CEO of Geneith Pharmaceuticals, I am thrilled to unveil an initiative that not only underscores our commitment to public health, but also seeks to catalyze meaningful change among our youth through strategic corporate social responsibility. called the Geneith Health Competition, powered by Kotal Subgel. To say that malaria is Nigeria's #1 health challenge is indeed to restate the obvious. And this is given that Nigeria, according to World Health Organization, WHO, reports showed us that accounts for 27% of global malaria cases. You all can agree with me, and 31% of malaria deaths. In 2022 alone, for instance, Nigeria experienced 66.7 million malaria cases, resulting in about 189,321 deaths, with the majority occurring in children under the age of 5 years. Also in the following year, 2023, malaria incident in Nigeria was 299 for every 1,000 persons. Of course, these figures are scary and sufficient enough to warrant declaring the battle against malaria a national emergency. And this is exactly what we are set out to do. We are gathered today under the theme, let's come together to reinvest, to reimagine, to reignite, and stay committed. This year's Malaria Day theme encapsulates our unified mission and serves as a guiding principle for our collective efforts in combating malaria. We must reinvest in our public health infrastructure, if only to effectively confront a disease that claims lives every minute. This will involve ensuring that necessary resources, financial, human, and technological advancements that are strategically allocated to combat this preventable illness. It will also require investing in community health programs, enhancing access to medical care, and ensuring that sufficient funding is directed towards malaria prevention and treatment initiatives. But that's not all. The battle against malaria also demands reimagining. It is important that we reimagine our approach to this challenge by embracing innovation and creativity, especially in how we'll address it. Our aim, therefore, is to use the Geneith Health Competition to encourage young minds to think outside the box with a view to developing new ideas, concepts, strategies for malaria prevention. This will involve leveraging technology through the social media and community engagement to raise awareness and drive positive change. Our target is also to reignite our passion for the battle against malaria. This will involve rejuvenating our collective commitment to the cause, especially among our youths, who are not only the leaders of tomorrow, but also the change makers of today. We do this by motivating them to take action. We'll be empowering them to become champions of public health, who will assist to spread the message of prevention and awareness in their communities. Having taken the above actions, we will also ensure that we stay committed to battle against malaria, if only to see that it is completely defeated. By reinforcing our dedication through continuous collaboration and advocacy, we will ensure that we maintain momentum in the battle until we will achieve a malaria-free Nigeria. We do this not to see through the Geneith Health Competition as just a mere event. It's not just a mere event. It is a movement. And it's a platform designed deliberately to engage students, especially those in tertiary institutions, in innovating problem solving and advocacy around malaria prevention by channeling their creativity and energy. We seek to empower them to take ownership of this fight, thus becoming champions of health in their various communities. Through this competition, participants will engage in public health advocacy, project designs, community outreach programs. These are efforts aimed at fostering a culture of health awareness and advocacy that is deeply rooted in the unique needs of local communities. With a prize pool exceeding over 120 million, this initiative reflects our unwavering belief in the potential of our youth to effect change. We understand that malaria disproportionately impacts vulnerable populations, particularly children under 5 and pregnant women. Our goal through this competition is to inspire a new generation of healthcare champions who will truly grasp the importance of prevention and effective communication. This initiative also aligns with the strategic objective of the World Health Organization, WHO, and Nigeria's National Rollback Malaria Program. The partnership amplifies our efforts, ensuring that we are reinforcing global and national goals in combating malaria menace. Ladies and gentlemen, as we embark on this significant journey, I urge all stakeholders, honorable ministers of health and education, state commissioners, development partners, policymakers at various levels, educators, civil society leaders, members of the press, etc., to join us in this fight. Your support, influence, and expertise will be required as we strive to extend our reach into all the nooks and crannies of Nigeria. Let us join hands and ignite the sparks of hope and innovation. Together, we can inspire our young leaders to dream, act, and ultimately guide us towards a malaria-free future. As we move forward, let us commit ourselves to this thematic framework to reinvest our resources and efforts into effective healthcare solutions. Reimagine how we approach malaria prevention, reignite our passion for public health advocacy, and stay committed to our goal of totally eradicating malaria in Nigeria. This is not just about a competition. It is about creating a culture of engagement and awareness among our youth, empowering them to understand the critical role they play in the battle against malaria, and inspiring them to take decisive action within their respective communities. We presently stand at the crossroads. You all can agree with us. Our actions today will shape the public health landscape of tomorrow. With every project designed, every campaign launched, and every community reached, we are inching closer to a future where malaria is no longer a formidable foe, but a chapter in our history that we have successfully closed. I therefore invite you to embark on this journey with us, which promises not just solutions, but a brighter and healthier future for both our children and fatherland. Together, we have the power to make a lasting impact. Ladies and gentlemen, let's seize this opportunity. Thank you very much, and thank you for your patience. Thank you for listening, and may God bless you all. Thank you.
I recognize the CEO, Geneith, my president, Pharmaceuticals Ltd of Nigeria, past president, and Your Excellency, you are recognized, and our representative of the Honorable Minister of Health, distinguished guests, and our students, and the Geneith staff, gentlemen of the press. On this occasion of the World Press Conference for the launch of Geneith Health Competition, it is indeed an honor for me to stand or to sit down before you today at this pivotal moment in Nigerians' health advocacy journey. I salute this bold commendable initiative by CEOAFRICA in strategic partnership with Geneith Health for the loud voice and campaign against malaria as part of the 2025 World Malaria Day commemoration. I don't need to dish out any further data, but we all know that malaria is a burden. It remains a very serious threat to our global health, and sadly, we carry more burden in the sub-Saharan Africa, and particularly in Nigeria. Most of the deaths, globally, occur, in the sub-Saharan Africa. Up to 95 to 97% of the global malaria deaths. Nigeria, alongside the Democratic Republic of Congo and Niger, I've said earlier, accounted for over half of the figure quoted. One key factor often overlooked in the spread of malaria is the human movement, especially in high-density areas where people are constantly on the move. This makes us all vulnerable, and it's a good reminder that malaria is not their problem. Professor Sefos just said it now. It is our problem. So this is why this initiative is just very timely. It's powerful, this initiative, because it is a call for action. Some of the persistent challenges we face in malaria control, we all know, include poverty, which limits access to prevention and treatment. Also inadequate and unsustained funding. We also have resistance to insecticide-treated nets, particularly in sub-Saharan Africa, where mosquitoes are evolving faster than our interventions. But we are not helpless. Promising new interventions have emerged, including the next generation insecticide-treated nets, and also the introduction of malaria vaccines. The community-driven awareness programs like this one that is about to be launched today, is very important in the new interventions available to us. And please note, prevention remains the best intervention method. Now let's talk about why we are really here today. The launch of the Geneith Health Competition, the bold initiative by Geneith on youth. Yeah, let me digress a little bit. I was just discussing with the CEO. When you want to achieve progress in any intervention, target the young people. When they know, wherever they go, they say it. They go to their parents, they talk about it. To their peers, their friends, they talk about it. So this is just the right target group we are launching the campaign for today. This isn't just a campaign, it's a movement. To me, it is a movement. It's one designed to roll back malaria through education, advocacy, and active engagement. It's national in scale. The way, because I read a little bit about what you're about to do. It is very strategic in the planning you are doing. And the bold execution will do a good job for us. It is powered by two forward-thinking institutions, CEOAFRICA and Geneith Pharmaceuticals, whose vision for malaria-free Nigeria is being translated into real action today. I'm proud to be part of this journey, and even more proud to witness the official unveiling of the Geneith Health Project and the launch of Geneith Health Competition with over 120 million worth of prizes across 3 major student categories. Junior secondary schools are involved, senior secondary schools are involved, and the tertiary health institutions are involved. This is more than a quiz. It is an empowerment platform, a tool for awareness, and a spark of sustainable change. In conclusion, let me say this. You have targeted the right population, as I said earlier. One, the population that is energetic, intelligent, and fully capable of driving this movement to a success. Am I correct? I'm indeed proud to be part of this, and I will be grateful if I can, I can follow through the processes, because I've engaged in youth programs and the progress of, my career. So I'm indeed proud, and I believe that together we shall succeed. Thank you very much.
The chairman of today's occasion, MD CEO of Geneith Pharmaceuticals, my immediate past present, my immediate ancestor, Honorable Minister, Commissioners, and all special guests present, my colleagues, ladies and gentlemen. I feel very happy to be part of this program today. CEO Cletus called me last week on phone and was telling me about the program. I checked my itinerary. I told him it is not possible because I had a series of workshops, meetings, conferences to attend. He just pleaded. I said, okay, if I see a window for me to attend, I will. I just came out of a residential workshop on preparing a policy on e-pharmacy just yesterday. And I'm supposed to be in Lagos tomorrow. So whether I'm in prayer or whatever it is, so today I happen to be free. So I decided to come. So I'm happy to be here. I commend Geneith Pharmaceuticals for organizing this event. Like you said in your speech, MD, this is part of your corporate social responsibility. And we wish every pharmaceutical company in Nigeria, and indeed every member of any industry, will set aside some funds for corporate social responsibility the way you are doing. We commend your effort, and may God help you. For my colleagues, I try as much as possible to attend this kind of events as a form of encouragement for our professional colleagues in the industry to give their best. Most of our fights is for them to have an enabling environment to carry out the activities so that we'll have what we call drug security in Nigeria, because the more we manufacture drugs in Nigeria, the more the drugs are available and the cheaper they become. So, sir, whatever we will do to encourage you to be able to enhance your manufacturing activities, let us know so that we can reach out to the government, do advocacy, and get it done. Thank you very much. I wish everybody a good day in this program, and may the best team win.
I need to acknowledge the chairman, the president, and all the members of the high table, as well as people sitting on ground on the opposite direction. Please permit me to sit to continue. Well, malaria is one of the oldest diseases documented, several centuries, millennium, I would say. Not until 1880, when one French, Charles Laveran, Alphonse Laveran, saw a parasite in the blood of a 24-year-old soldier. He saw it but didn't understand it. 17 years later, in 1897, another man came up. That's Sir Ronald Ross. And there I was able to learn that it's possible that mosquito bite was responsible for malaria, but I didn't know beyond that. Then another scientist, a physician, Patrick Manson, eventually linked the two. That is the bite of mosquito leading to the disease. By the year 1900, it was published in British Medical Journal that what was actually responsible for malaria was the bite of a female Anopheles mosquito. And at that point, the knowledge was clear, and every country went to action. By 1912, Belgium pushed malaria to a point where it was no longer a public health disease. By 1922, Britain was able to push it down to a point that it was no longer a public health issue. America lasted to 1947. By 1964, almost all the European countries have been able to eliminate malaria. And coming down to Africa, unfortunately, no African country achieved this. Nigeria hosted the biggest meeting on malaria in the year 2000, which led to the rollback malaria meeting in Abuja here, and where there was Abuja Declaration. 25 years gone, Nigeria is still having malaria. We were lucky in the past few years, about 4 African countries have been able to achieve elimination. Algeria has been able to eliminate malaria, and Cabo Verde of recent, we had also has eliminated malaria. Nigeria hosted the rollback malaria. And just last year, the coordinating minister hosted another big meeting that brought almost the entire world in the medical field to Abuja. And that was rethinking malaria in Nigeria. All these are the efforts. Where are we as a country? We indeed probably have not done enough. And one of the 9-point agenda the coordinating minister mentioned was the community involvement. And it rings very clear in this particular meeting, involving children. We should also know that malaria is not just a health issue. We look at it from the point of our failure, that is the sickness. But it's infrastructural problem, it's environmental problem, and the consequences could be emotional, could be economic, and several others. These are the things we've been battling. And I must commend you that the efforts of your organization, Geneith Pharmaceuticals, is great and is laudable. And I think it is driving one of the points of the coordinating minister home. On this, thanking the chairman for inviting the coordinating minister, who unfortunately is unable to be here this morning because he traveled out. And he has asked me to represent him and also to congratulate you and bring his facilitation to this program. On this, I want to declare and launch the Geneith Health Competition open. Thank you very much.
The Chairman, Pharmacy Council of Nigeria, the CEO and the Oga Patapata of Geneith Pharmaceuticals. It's not, is it? Okay. Yeah. My chairman has regulated me. She said I should sit down. For you to have taken the bold step to address this public health problem, we say kudos to you. Particularly when Nigeria accounts for over 25% of malaria cases in the world. And indeed, I know one of my PhD students worked on the pharmacoeconomics of anti-malarials. And one of the things they came up with, Professor Waka, was the fact that when somebody has a malaria issue, it affects the workforce, it affects the family, and it affects everybody indeed. So I think taking the opportunity to invest and reignite this issue is quite welcoming, and making sure that this opportunity is being propagated by students, particularly in the higher institution, is also remarkable. Because when they are more enlightened and they know these things, they will be able to drive what we need to do to bring down this menace in the society. I will tell you this, and I will end with this. When I wanted to start my PhD program, sometime in 86, 87 in Germany, I wanted to get involved in the malaria vaccine program. But whether you like it or not, I was not allowed to, because malaria wasn't their problem. Yes. And so we believe that other people, other stakeholders will emulate your effort and then work with you, and we can together bring the cause of malaria, the burden of malaria down in this country. Being the most populous black country, I believe we should be able to bring it down so that our workforce can benefit. Once again, I say kudos to you, and we hope that this program will go a long way. Thank you very much.
The chairman of today's occasion, MD CEO of Geneith Pharmaceuticals, my immediate past present, my immediate ancestor, Honorable Minister, Commissioners, and all special guests present, my colleagues, ladies and gentlemen. I feel very happy to be part of this program today. CEO Cletus called me last week
on phone and was telling me about the program. I checked my itinerary. I told him it is not possible because I had a series of workshops, meetings, conferences to attend. He just pleaded. I said, okay, if I see a window for me to attend, I will. I just came out of a residential workshop on preparing a policy on e-pharmacy just yesterday. And I'm supposed to be in Lagos tomorrow. So whether I'm in prayer or whatever it is, so today I happen to be free. So I decided to come. So I'm happy to be here. I commend Geneith Pharmaceuticals for organizing this event. Like you said in your speech, MD, this is part of your corporate social responsibility. And we wish every pharmaceutical company in Nigeria, and indeed every member of any industry, will set aside some funds for corporate social responsibility the way you are doing. We commend your effort, and may God help you. For my colleagues, I try as much as possible to attend this kind of events as a form of encouragement for our professional colleagues in the industry to give their best. Most of our fights is for them to have an enabling environment to carry out the activities so that we will have what we call drug security in Nigeria, because the more we manufacture drugs in Nigeria, the more the drugs are available and the cheaper they become. So, sir, whatever we do to encourage you to be able to enhance your manufacturing activities, let us know so that we can reach out to the government, do advocacy, and get it done. Thank you very much. I wish everybody a good day in this program, and may the best team win.
Our fathers and mothers on seat, the commissioners for education, to Taraba State Governor, the mother of Nigerian students in Taraba State, we recognize you, ma. The co-founder of this great company, the chairman, all other dignitaries here present are recognized. So I recognize my co-students that are present here this morning. By the virtue of introduction, I'm not Egun Jobi, I'm Egun Jobi. So my name is Ambassador Comrade Egun Jobi Samuel Oluwaseun, and I'm a student of Osun State College of Education, Ilarango. And I'm happens to be the national president for National Association of Nigerian Colleges of Education Students, NACES. And at the same time, I'm also the chairman of the president of Colleges of Education, Universities, and the Polytechnic in Nigeria. So these are my co-presidents beside me. So this is Comrade Oyewumi Festus. He is the president of 4 Polytechnic students in this country. He is from Oyo State. And he, standing beside my right hand, is Comrade Peter Ojo, the president of all university students. And he is from University Bauchi State. Without wasting time, I would like to firstly commend the effort of these two companies that are collaborating together to bring this initiative: the Genetic Health Competition, the Genetic Health Company, and the CEOAFRICA. They have done a great job, and I can tell you that because we cannot put everything on the neck of the government. We also, as an individual, the little that we can contribute to the community, we should do it. So on this note, we are appreciating the entire Nigerian students, are appreciating the initiators of this great initiative. We have spoken before now, we have given them our words. We are assuring you that the over 40 million students in Nigeria, we are their representatives. We are solidly behind you on this to pursue this great initiative. And I can tell you that we will reach the promised land by the special grace of God. Because, another says earth is wet. And malaria, some people make a mistake most time that it's just a malaria. If you have experienced this, you will know what it means that it's not just a malaria. It takes lives. It takes lives. So, by the grace of God, we promise you that we are on this together. Thank you very much. And also, we are passing a vote of confidence on the CEOAFRICA. They are doing a great job. Aluta continua.
Stand on all the existing protocols and say good morning to everybody. Mine is just a very short one. I thought it would be very important to talk about the benefits of this competition. This competition, just like the chairman and the CEO of Geneith Health mentioned in their speeches, will educate young people, will dispel myths concerning malaria, encourage preventive behavior, I'm like summarizing it, encourage preventive behavior, empower young people, inspire young people to develop positive, innovative approaches, just like the chairman said earlier, support research and development, because it will go beyond just the competition. Students will want to go into research in that area. It will help in building community engagement, just like the chairman said, and peer-to-peer education in their discussion, they sit down, they want to discuss these things and even create other type of competitions within themselves. It will also help to develop skills in critical thinking, because we'll be asking them questions, critical questions and problem-solving skills, then communication and teamwork. So, finally, by hosting a competition on malaria disease for young people, Geneith Pharmaceuticals is empowering them to become agents of change in their communities, promoting malaria prevention and control. I want to wish all competitors the very best. And I also want to say a very big thank you, sir, for organizing this competition. Thank you.
I want to stand on the existing protocols as laid down by the MC. And I want to use the opportunity to salute the efforts of the initiators of this program. It is quite laudable and salutary. We are proud of the company, especially the CEO, who has decided to earmark such a very massive fund towards this program. For us, we will be ready to collaborate and support this program as much as possible. So we thank every one of you for making it to this press conference. And we thank the organizer. Thank you very much.
Good morning, everybody. Let me stand on all the existing protocols. I know my president is here, chairman, and pharmaceuticals is here, and the immediate past president for of Nigeria. My name is pharmacist Nuru Emeka Kalistus, former national secretary for Pharmaceuticals of Nigeria. I'm here to represent the chairman board of fellows. Pharmacist Uche Apakama. And let me start by commending and thanking the CEOAFRICA and Geneith Pharmaceuticals. The war against malaria is a war that must be won. I know that Geneith Pharmaceuticals has done a lot in the area of prevention, treatment, and this gathering is a sign that they want to now direct their effort towards eradication. Because I know that for you to do anything creative, the youth must be involved. And this time, our students from secondary schools and universities. I want to thank Geneith too, because I know that malaria is our common enemy. And I believe that with this kind of platform, the right energy will be directed towards the area we have not done so much on, and that's the area of eradication. I want to thank you once again, and I wish you success.
All esteemed guests here present, especially those at the high table, all esteemed guests seated here as participants, ladies and gentlemen, members of the press, good morning. I am highly delighted to be here. I had to take a long journey to come all the way from Jalingo because anything that has to do with students, I personally am very passionate. As the Commissioner for Education and as a teacher by profession, I'm a mother to all the students. And so malaria is a disturbance to my own children. And when I saw about this Geneith health competition, and particularly there was one of you here that kept in touch with me to encourage me to come. I'm very happy for that encouragement, and I want to sincerely congratulate Geneith company for bringing up this initiative. Our children are as intelligent, as talented as other children all over the world. And I believe that this competition is going to stimulate a lot of brainstorming, a lot of cognitive interaction for the children. A lot is going to come up on the table for our children. So I am looking at it with keen interest to see how my own students, both at the basic section and at the tertiary, we are going to collaborate with the Commissioner for Tertiary to ensure that as this goes on, our children will key into it and that we give them the best support they need to be able to participate. So I congratulate you, and I hope that this will be the beginning of a greater future in terms of the health of our children as it affects malaria for us. So thank you so much, and thank you for bringing us. God bless us.
Let me stand on the newly established protocol for some time. I want to commend the Geneith Health Competition because the Geneith pharmacists coming into this public health challenge and choosing malaria in our society is a great encouragement, because looking at or leaving malaria fight to only public sector or to government is not achievable. If we have private sector of Geneith to join hand with the government, I want to believe we can one day issue malaria in this country. So I want to commend most sincerely the Geneith Pharmaceutical Company with this initiative, and I want to believe these competitions will take back the major problems that are preventable in our primary, in our secondary and tertiary level, environment, environmental, especially in the elementaries and hostels. This is where the major problems have been. A lot of measures, a lot of policies were put in place by various government, but with this private initiative, I believe will contribute immensely to achieve and resolve the issue and reduce the menace of malaria in our society. Thank you very much.
The protocol is already established, but I must recognize my two presidents, the immediate past president and our own president, my own daughter, who is the chairman of the Pharmacy Council of Nigeria, Ma Pate. I recognize every other dignitary on the high table and every distinguished guest here. I stand here wearing two caps, though they didn't give me a cap, I would have worn it. And I speak on behalf of pharmacists, Lena Lam, Scholastica Lam, who is the national chairman of Association of Lady Pharmacists. When we talk about burden, malaria burden, we know those that are suffering from it. Those the vulnerable group are usually women, pregnant women, and even children under 5. I want to, as lady pharmacists, commend this great laudable initiative and to give our own support that we are definitely going to be part of this room. Like our chairman said, I remember when during the advocate of checking that number, my little baby of about 5, whatever you buy it, have you checked the NAFDAC number? So using children, school children is like creating awareness. And then, like I say, public health now attending towards preventing. And this initiative is actually commendable. I want to thank you. Thank you all.
Let me start by recognizing my teacher and my former Vice Chancellor, Professor Geneith, who is here present. I also like to recognize the organizers of this important event and all those who are here, commissioners, other important dignitaries. Thank you very much for giving me this opportunity. I thank the Commissioner for Basic and Secondary Education. I feel it is very necessary and important for me to be here. What I just wanted to say one or two things. Each time I go out for sport mission of my school sports, primary and secondary, I always find students, eaten by malaria, particularly girls. Yes, particularly girls. Most of the schools I went to, 5 girls lying down, 5, 3, 4, 5 of them. I was even asking some health personnel, what is really the problem? Is it that in terms of genetic makeup, they are more vulnerable? So we started discussion on that. Now, why I feel it is important for me to talk is because of the fact that when I look at the caption, junior secondary and senior secondary schools, of course in my state, they are all under my ministry. But then I'm just wondering, what about the primary school children? Why is it they are not captured here? Because one, they are the majority. If you take the total number of students in every state, I think primary school children constitute about 70%. So I feel if we can organize this competition in our primary schools, it will create a lot of competition. And in the primary schools, there are children, many of them don't even know what is malaria. When they fall sick, particularly when they are in the school, they may not even be going to the hospital. So I think it is important for us to expand this and see how we can also include primary school. Then another thing is that I was reading in the newspapers and I saw that Brazil has introduced a scientific approach towards controlling malaria by introducing what they call male sterility, inducing male sterility, preventing females from producing eggs and thereby, getting to have fertilization. So I don't know if this organization can begin to think along that line, trying to make sure that the female mosquitoes do not produce eggs by inducing male sterility. I think if we can do that, that is a very important approach. Thank you very much.
Thank you. Good morning, everyone. Please permit me to stand on already established protocol. But nevertheless, let me also recognize my president of the Pharmaceutical Society of Nigeria and my immediate past president, Alhaji Tanko Ayuba, and Professor Cyril Odenose Osifo, both of whom are on the high table. And even the chairlady herself of this occasion, who is also a pharmacist, a fellow of Pharmaceutical Society of Nigeria, and all other dignitaries on the high table. And the chairman, MD CEO of Geneith Pharmaceuticals. I greet all of you. And the rep of the Minister of Health, I greet all of you. Thank you for being here at this important occasion. Having said that, I am the national chairperson of the Nigeria Association of Pharmacists in Academia. And part of our core mandate is to educate, train the future pharmacists of tomorrow, and as well as conduct research into various issues of public health importance top of which is malaria, the malaria scourge. And so you will agree with me that our core mandate aligns with the vision of Geneith Pharmaceuticals to combat the malaria scourge, to fight it to a standstill, and if not possible, to reduce it to the barest minimum. That is why we are here this morning represented. I stand on behalf of all the pharmacists in academia, nationwide and in the diaspora, to say we appreciate Geneith Pharmaceuticals Ltd. Sir, you're doing a good job. And our prayer is that God will strengthen you and give you the grace and the provision to carry this vision, this noble vision, to a conclusive end. That at the end of the day, we say bye-bye to malaria. And like the Minister of Health said, part of what we also need to do lies with the government. All the ministers, all the commissioners, all the governors, if you can keep a clean environment, malaria will be almost all a thing of the past. There's no malaria in parts of Canada, America, UK. Why? Because of the environment. So if you see malaria abroad, they're imported by people from Africa, particularly West Africa. So please, let's not export malaria. Let's combat malaria and cause it to come to a standstill. Thank you very much for this wonderful project. I pray that going forward, our members stand ready to work with you, to collaborate with you, either as assessors or researchers, to bring this problem to a conclusive end. Thank you very much. God bless you.
You know one thing I want you to do for me? Let's give 3 big bozas to the CEO of Geneith Pharmaceuticals. 1 boza first. Boza. I can't hear you. What about other people over there? Boza. Another one? Boza. And a big one? Boza. Yeah, I'm saying this, just like I said in my speech. This is a very bold and strategic initiative. Yeah, we've been looking for a way of rolling back malaria. This is a very brilliant step we are taking today. And I can assure you it's already a big challenge to other pharmaceutical companies. Because, you know, in public health, we need this kind of interventions. Am I correct? Yeah, right. Yeah. It's not just, you know, about say, oh, the government will do it. The government will do it. All of us, we are government. And if we have opportunity, especially in pharmaceutical industries, we produce drugs for, you know, eradicating malaria. And, you know, Geneith, you know, MD is not even afraid that if we eradicate malaria, we won't be able to sell malaria again. But do you know there are other emerging diseases? And then we will have, you know, more opportunities to make more money and solve problems. So this is why, you know, I'm aligning greatly with this initiative. And I want so many other pharmaceutical companies to think alike and pick on other areas of interventions to support our health system in Nigeria. And I'm proud, because I'm a pharmacist, that a pharmaceutical company is doing this for us today. And again, the target group is right. It's strategic. And they can do it. Because we've tried, you know, some initiatives on HIV/AIDS before using the youths, you know, in secondary schools and tertiary institutions. Like I said, they don't keep quiet. They keep moving with the message. Are you there?
Yes.
You keep what?
Moving with the message.
Please keep moving with the message. And I want you, you know, to tell the world that this initiative that is taking here, you know, must be something, you know, that should be replicated in so many, you know, West African countries where we have great burden of malaria. So, I don't want to waste your time. This is the right moment. We want to unveil the very big, brilliant, and bold project we are talking about. Can you all join me? Yeah. as we unveil this, to the glory of Almighty God, and to have His blessing on this, and for this project to be very successful.